COVID-19 can leave survivors with organ damage. Joining us to shed some light on this is Dr. Anish Tolat, electrophysiologist at Hartford Healthcare's Heart and Vascular Institute. Doctor, welcome.
Thank you. Thank you, Lisa.
Tell us your thoughts about a recent study where researchers found heart damage among more than half of the 1,200 COVID-recovered patients. Are those surprising findings for you?
Yes, that study actually comes from the European Heart Journal that was just recently published, where they looked at over 1,200 patients across 69 countries, and they looked at patients with COVID-19 in the hospital, and they looked at patients by echocardiogram or cardiac ultrasound, looking at their heart function. And what was really surprising was that those patients, about 55% of patients, had some form of heart damage. And when they excluded people who had pre-existing heart disease, they still found 46% of patients had some form of heart damage.
Well, speaking of COVID-recovered patients, can they develop arrhythmias as a result of having the virus? What are you seeing and hearing?
Yeah, so this is obviously very early in the disease process. We're still learning a lot about it, but there was a recent study from Circulation, one of the leading heart journals, where they actually did MRI of the heart in COVID patients with a positive protein called troponin, and they found that those patients did have scarring evidenced by the MRI. So we know that scarring can predispose to arrhythmias in the future, and we're going to have to wait and see if these patients are at higher risk in the future.
We learn so much every week. All right, what about patients with abnormal heart rhythms or who have a defibrillator pacemaker? Are they at a greater risk of developing COVID-19?
That's a very common question that we get a lot of, and I think the answer is, by itself, a pacemaker or a defibrillator or a history of arrhythmia doesn't predispose you to a worse outcome with COVID-19, but many of these patients do have other conditions such as diabetes, hypertension, or congestive heart failure, and those patients are at higher risk for developing COVID-19 related complications.
All right, as you mentioned, so much is being learned and so many unanswered questions. And what are you telling your patients when it comes to precautions?
Yeah, so I think that we've all been telling our patients that the social distancing here in Connecticut that we've been practicing, as well as covering the face, when out in public, and also washing your hands when you're out and about will help to protect you. And I think that in Connecticut here we've done a really great job with that.
I know, it is really amazing to see when so many masks, social distancing in most places. All right, Dr. Anish Tolat, thank you very much for joining us and shedding some light on the cardiology side of the COVID pandemic. We appreciate your time.
You're very welcome. Thanks, Lisa.
Thank you.